Am I audible? Please send me message. If I'm not audible, so please inform me first. Okay. Okay. Fine. Fine. Thank you. Thank you. Hi everyone. Welcome to Optimism Live Classroom. My name is Saurabh. Today our topic is Symblepharon. Symblepharon not actually a disease. This is a clinical degenerative conditions of ocular surface. What we mean for ocular surface, that is the epithelial surface of cornea, conjunctiva, including bulbar and palpebral conjunctiva, and there additions between the palpebral conjunctiva with the bulbar conjunctival epithelium or corneal epithelium or both, and there may be involvement of fornix, I mean conjunctival fornix or not. So according to all that different the severity of symblepharon, we can divide symblepharon into two types. One is complete. For complete addition, we can say that this is a complete symblepharon, which is characterized by the addition between completely between bulbar conjunctiva and the palpebral conjunctiva, and also with the corneal epithelium. But in case of partial symblepharon, the addition is between uh, palpebral conjunctiva and the bulbar conjunctiva, covering the sclera. So first we will talk about the definition of symblepharon. What is symblepharon? Symblepharon is a partial and complete addition between palpebral and bulbar conjunctiva or cornea. So according to the addition between bulbar conjunctiva and palpebral conjunctiva along with corneal epithelium, we can talk. We can tell the category of this symblepharon as complete symblepharon, and when there is the partial addition, that means there is no involvement of cornea, then we can tell that that is partial symblepharon. So now we will talk about the etiology. That means what are the possible causes of symblepharon. Uh, so first is chemical burn, second is traumatic lacerated wounds of ocular surface, and third is cicatrizing conditions of conjunctiva like ocular cicatricial pemphigoids, Steven Johnson syndrome, membranous conjunctivitis. These all are the causative factors for having symblepharon. So now we'll talk about the classification of symblepharon. There are three categories of symblepharon. One is anterior symblepharon. Anterior symblepharon involves there is no involvement of fornix, no involvements of fornix. But in case of posterior symblepharon, there is fornix. Fornix is mainly affected. Uh, First, I want to make you understand, giving an example like that. If we pass a prop or any glass rod below or beneath the additions of symblepharon, then we can diagnose that it is a anterior symblepharon because fornix is not involved there. But if fornix is involved, then we cannot pass the prop or glass rod beneath the additions between the palpebral conjunctival epithelium and the bulbar conjunctival epithelium. And if we diagnose the both conditions, like involvement of fornix along with palpebral conjunctiva connected with bulbar conjunctiva and also with the epithelial part of cornea, then we can uh, categorize this symblepharon like total symblepharon. Okay. Now we will talk about the clinical features which involves which includes the sign and symptoms of symblepharon. First, the patients complain like ocular pain, irritations, watering, disfigurement, and diplopia are frequency the symptoms that comes from the patients. And diplopia is the main cause of being a squint or deviation of eyeball. And what are the causes of deviation of eyeball? There are a lot of causes of being deviation of eyeball, and one is important cause is that the restriction of eyeball movement, which is also caused by having symblepharon. So if we see the next clinical features of symblepharon, like eye cannot be opened adequately and ocular movements are restricted, then we can understand why diplopia is occurred in case of symblepharon, right? Okay, fine. Then we will come to the next clinical features, that visible fibrous bands join between the eyelid and anterior part of the globe. Anterior part of globe means the anterior ocular surface or anterior surface of cornea and bulbar conjunctiva without involving fornix. So I already said that without involvement of fornix, symblepharon is categorized into uh, anterior symblepharon. I mean, if fornix is not involved, then this type of symblepharon is called anterior symblepharon. So here, according to these features, we can say that this is anterior symblepharon. Why? Because the fibrous band joins only between the palpebral conjunctiva part and the bulbar conjunctival part without involving the fornix. That is anterior symblepharon. But what is posterior symblepharon? The posterior symblepharon involves only the addition between or addition at the level of fornix only. Okay, so a broad band is seen attached to the fornix in posterior symblepharon. So what we understand after reading these two features, in case of anterior symblepharon, uh, multiple bands are seen visible, multiple fibrous bands are visible. But in case of posterior symblepharon, a broad, that means a large size band is seen. Not very large, but comparatively large bands according to the previous in case of anterior symblepharon, there is a broad band is seen in case of posterior symblepharon. And lastly, the presence of lag of thalamus can cause exposure keratopathy. How it can be occurred? Because if patient cannot blink their eyelids, so their cornea is exposed to the air, and for that reason the tear films get evaporated, and the thickness of the tear film get decreased, and as well as the many pathogenic microorganisms can invade easily into our eyeball to infect our eyeball through the cornea. That is exposure keratitis or exposure keratopathy. Now we will talk about the treatment of symblepharon. Symblepharon formation can be prevented by repeated sweeping of a sterile cotton buds or glass rod or glass thermometer tip soaked in eye ointment containing liquid paraffins in the fornix. The second treatment is that the application of a contact lens or a symblepharon ring and meticulous suturing of initial conjunctival wounds are the preventive measures. These all are the way of treatment through the preventive measures. But if anyone have already developed symblepharon, I mean, if symblepharon has already been developed in any patient, then patient should be advised to go for surgical correction. So what will be the surgical correction? surgically corrected by the symblepharectomy and Z-plasty. These two methods are used to correct symblepharon surgically. And finally, in case of recurrent symplepharon, because of changing the nature of genes of the cells in that area where symplepharon is continuously or recurrently developing, extensive simple in that case, conjunctival autograft or amniotic membrane transplantation are required to correct recurrent extensive symplepharon. That's all about the today's class. If you get happy after seeing my this video, please subscribe my channel and press the bell icon beside the subscribe button to get the notification of my upcoming videos of classes quickly. So thank you so much. Thanks for watching this video. All the very best. Keep watching and keep studying. Thank you.